Hello, everyone, and welcome to Easy Does It Counseling's Psychoeducation and Skills Training series. I am here to guide you through today's session on self-care routines for ADHD. Now, before we dive into our topic, I'd like to take a moment to introduce to you Easy Does It Counseling and our unique approach. We are an online counseling service serving residents of Alaska, Colorado, Hawaii, and Louisiana. Our focus is on providing specialized care for LGBTQIA+, neurodiverse individuals, and those dealing with suicidality. What sets us apart is our team of BIPOC therapists. We are trained in cultural linguistics, alliance-based suicidality treatment, and neurodiversity models. Our approach is rooted in humility and partnership. We believe that treatment should be a collaborative process honoring your self-determination, self-agency, and self-concept. Our clinic was founded by Dr. Ezra Lockhart, who brings 20 years of healthcare experience to the table, with extensive expertise in areas like autism spectrum disorder, ADHD, anxiety disorders, and addiction. Their experience includes working with approximately 15,000 individuals experiencing suicidality, and they practice in both metropolitan and rural locations. At Easy Does It Counseling, we are committed to ongoing training and development. Our services range from individual counseling to family therapy, social skills development planning, and much more. And so now let's turn our attention to today's topic, self-care routines for ADHD. Whether you're dealing with challenges of ADHD, managing stress or anxiety, or simply want to improve your overall well-being, the skills we'll discuss today can be incredibly beneficial. Today, we'll explore how developing a self-care routine can be a powerful tool in managing ADHD symptoms. We'll cover the basics of self-care, dive into its specific benefits for individuals with ADHD, and learn practical techniques that you can start using right away. I encourage you to engage with this content actively, even though this is a recorded session. Feel free to pause the video at any point if you need to take a break, want to practice a technique for longer, or need time to reflect on what you've learned. This is your learning experience, and it's important that you go at a pace that feels comfortable for you. So let's get started. And remember, this is your journey, so feel free to pause, rewind, or take breaks as needed. So let's get started by taking a look at what we'll be covering in today's session. This overview will give you a roadmap of our discussion and help you understand what to expect. First, we'll answer the fundamental question: what is self-care? We'll explore this concept in detail, helping you understand what we mean when we talk about self-care, especially in the context of ADHD management. Next, we'll discuss why self-care is particularly helpful for individuals with ADHD. As many of you know, ADHD presents unique challenges, and we'll explore how a consistent self-care routine can specifically address some of these challenges. Then, we'll dive into the components of an effective self-care routine. We'll go through a step-by-step process that you can use to develop and maintain a self-care routine that works for you. After that, we'll go over some practical tips for incorporating self-care into your daily life. We understand that developing new habits can be challenging, especially for those with ADHD. So we'll provide strategies to make this process easier and more effective. Finally, we'll address some common challenges you might face when trying to implement a self-care routine, and we'll discuss solutions to overcome these obstacles. Throughout this presentation, I encourage you to think about these concepts and techniques and how they might apply to your own life. Consider your current challenges with ADHD and how a consistent self-care routine might help. If questions come up as we go along, feel free to write them down for later reflection. And remember, the goal of this session is not to just provide information, but to equip you with practical skills that you can use in your daily life. So let's dive in and start exploring the world of self-care for ADHD management. So what exactly is self-care? Self-care encompasses a wide variety of practices that individuals engage in to maintain and enhance their physical, mental, and emotional well-being. It's crucial to understand that self-care isn't just about pampering yourself or indulging in luxuries, as is often portrayed in popular media. While those activities can certainly be a part of self-care, the concept is much broader and more fundamental to our overall health. Self-care is about taking deliberate, proactive actions to care for your health and well-being in a holistic way. It's about recognizing your own needs and taking steps to meet them, rather than pushing through and ignoring the signs that you need to slow down or take a break. This can involve saying no to commitments that overwhelm you, setting boundaries in relationships, or simply taking time each day to do something that recharges your batteries. When we talk about self-care, we're addressing three main aspects of our lives: physical care, mental care, and emotional care. So physical self-care, this includes activities that maintain and improve your physical health. Some examples include regular exercise, which could be anything from a structured gym routine to taking a daily walk in nature. Eating a balanced nutrition diet that fuels your body properly. Getting enough sleep, which for most adults means 7 to 9 hours per night. Staying hydrated by drinking enough water throughout the day. Attending to medical needs such as regular checkups, dental visits, or managing chronic conditions. And practicing good hygiene, including regular bathing, dental care, and grooming. Physical care is the foundation upon which all aspects of self care are built. When our physical needs are met, we're better equipped to handle mental and emotional challenges. Next is mental self care. This involves practices that stimulate your mind and maintain cognitive function. Some examples include reading books or articles on topics that interest you or challenge your thinking, solving puzzles or playing strategy games to keep your mind sharp, learning new skills, whether it's a new language, a musical instrument, or a craft, engaging in creative pursuits like writing, painting, or photography, practicing mindfulness or meditation to improve focus and reduce stress, and taking breaks from technology to avoid information overload. Mental self care is particularly important in our fast paced, information rich world. It helps us stay sharp, adaptable, and resilient in the face of cognitive challenges. And third is emotional self care. This focuses on understanding, processing, and managing your emotions. Some examples include journaling to explore and express your feelings, talking with a trusted friend, family member, or therapist about your emotional experiences, practicing self compassion and positive self talk, engaging in activities that bring you joy and relaxation, such as listening to music, dancing, or spending time in nature, setting healthy boundaries in relationships to protect your emotional energy, allowing yourself to feel and express emotions fully rather than suppressing them. And lastly, using techniques like deep breathing or progressive muscle relaxation to manage stress and anxiety. Emotional self care is crucial for maintaining mental health and building resilience. It helps us navigate the ups and downs of life with greater ease and self awareness. For individuals with ADHD, establishing a consistent self care routine is particularly vital. ADHD can often lead to challenges with impulsivity, distractibility, and emotional dysregulation. These symptoms can make it difficult to maintain healthy habits and can lead to burnout if not properly managed. A well rounded self care routine can help manage these symptoms and promote overall well being. For example, regular exercise can help improve focus and reduce hyperactivity. Mindfulness practices can aid in managing impulsivity and improving emotional regulation. Establishing routines around sleep and nutrition can help stabilize mood and energy levels. And engaging in activities that stimulate the mind in enjoyable ways can help satisfy the ADHD brain's need for novelty and stimulation in a healthy manner. Self care also promotes balance and resilience. In the often chaotic and fast paced world we live in, taking time for self care can help you find moments of calm and stability. This is especially important for those with ADHD who might struggle with feeling overwhelmed or overstimulated. By incorporating regular self care practices, individuals with ADHD can create islands of calm in their day, helping to reset their nervous system and improve their ability to handle stress. It's important to note that self-care looks different for everyone. What works as a self-care practice for one person might not work for another. For instance, while one person might find a vigorous workout energizing and stress relieving, another might prefer a gentler form of movement like yoga or tai chi. Some people might find solitude rejuvenating, while others might recharge through social interaction. The key is to find activities and practices that resonate with you personally and that you find genuinely beneficial. Now, I want you to take a moment to reflect on your own understanding of self care. What does self care mean to you? Is it something you prioritize in your life, or does it often fall by the wayside when things get busy? What activities or practices do you currently engage in that you would consider self care? Are there areas of self care, physical, mental, or emotional, that you feel you're neglecting? Think about a time when you practiced good self care. How did it make you feel? Did you notice any changes in your mood, energy levels, or ability to focus? Conversely, can you recall a time when you neglected self care? What were the consequences? Feel free to pause the video here if you want to take a moment to jot down your thoughts. This reflection can be a valuable first step in developing a more intentional approach to self care. In our next slide, we'll explore more specifically why self care can be so helpful for managing ADHD symptoms. We'll look at how different self care practices can directly address common ADHD challenges, and we'll discuss strategies for incorporating self care into your daily routine in a way that's sustainable and effective. As a reminder, investing in self care isn't selfish, it's necessary. By taking care of yourself, you're ensuring that you have the energy and resources to show up in all areas of your life, whether that's work, relationships, or personal pursuits. In the context of ADHD, good self care can be a powerful tool for managing symptoms and improving overall quality of life. Now that we understand what self care is, let's explore why it's particularly beneficial for individuals with ADHD. Self care offers several key benefits that directly address common ADHD symptoms and challenges. First and foremost, self care reduces stress. Individuals with ADHD often experience higher levels of stress due to the challenges they face in daily life, such as difficulty with time management, organization, or meeting deadlines. Regular self care activities can significantly lower stress levels. This is crucial because high stress can exacerbate ADHD symptoms, creating a vicious cycle. By engaging in self care, you're giving your mind and body a chance to relax and reset, which can make ADHD symptoms more manageable. Secondly, self care enhances focus and productivity. This might seem counterintuitive at first because how can you make time for yourself to improve your ability to get things done? Well, when we engage in self care activities, we're essentially refreshing our mind and body. This can lead to improved attention and efficiency in tasks. For example, taking a short break to some deep breathing or light exercise can help clear your mind and increase your ability to focus when you return to work. Third, self care supports emotional regulation. ADHD often comes with challenges in managing emotions, leading to mood swings or impulsive reactions. Taking time for self care fosters better emotional health. When you're regularly engaged in activities that bring you joy, relaxation, or a sense of accomplishment, you're building emotional resilience. This can make it easier to manage the emotional ups and downs that often come with ADHD. And lastly, a consistent self care routine promotes overall well being. It encourages a holistic approach to health, contributing to physical fitness and mental clarity. For individuals with ADHD who might struggle with maintaining consistent healthy habits, a self care routine can provide structure and motivation for taking care of oneself in a comprehensive way. It's important to note that these benefits are interconnected. For example, by reducing stress and promoting overall well being, self care indirectly supports better focus and emotional regulation. It's a positive cycle where taking care of yourself in one area often leads to improvements in other areas as well. Now, I want you to take a moment to reflect on your own experiences with ADHD. Can you think of times when taking care of yourself, whether through exercise, relaxation, or engaging in a hobby, has helped you manage your ADHD symptoms better? How do you think a more consistent self care routine might impact your daily life? Again, feel free to pause the video here if you want to take some time to think about it or to write your thoughts down. Remember, self care is not a cure all or a replacement for other ADHD treatments. Rather, it's a complementary approach that can enhance your overall ADHD management strategy. When used consistently alongside other treatments and techniques, self care can significantly improve your ability to navigate the challenges of ADHD. In our next slide, we will dive into the specific components of an effective self care routine. If you're feeling unsure about any aspect, remember that we'll be exploring these concepts further with practical examples as we continue. Now that we have a better understanding of what self care is and why it's beneficial for ADHD, let's dive into how to develop an effective self care routine. Creating a self care routine involves several steps, and we'll go through each one in detail. One is identify self care activities. The first step is to consider activities that resonate with you and promote relaxation or joy. Remember, self care is personal, so what works for someone else might not work for you, or vice versa. And some common self care activities include physical exercise like walking, yoga, or dancing, mindfulness practices such as meditation or deep breathing, creative outlets like drawing, writing, or playing music, and leisure activities such as reading, gardening, or doing puzzles. Take a moment to think about activities you enjoy or that make you feel good. These could be things you already do or new activities you'd like to try. Don't limit yourself. Self care can be anything that nurtures your physical, mental, or emotional well being. Second is set realistic goals. When it comes to self care, especially for individuals with ADHD, it's crucial to start small and set achievable goals. Aim for consistency rather than perfection. For example, you might start by scheduling 10 to 15 minutes a day for an activity you enjoy. Remember, a small amount of self-care done consistently is more beneficial than ambitious plans that are hard to maintain. Third, create a schedule. For many people with ADHD, having a structured routine can be very helpful. Designate specific times in your day or week for self-care activities. Treat these times as important appointments for yourself. You might find it helpful to use a planner or a digital calendar to schedule your self-care activities. Fourth, practice mindfulness. During your self-care activities, try to focus on the present. Notice your thoughts, feelings, and physical sensations without judgment. This mindful approach can enhance the effectiveness of your self-care practices. For example, if you're taking a walk, pay attention to the sensation of your feet hitting the ground, the sounds around you, or the feeling of the air on your skin. And five, evaluate and adjust. Regularly assess how your self-care routine is working for you. Be flexible and willing to adjust activities or schedules as needed to better fit your lifestyle and preferences. What works for you might change over time, and that's okay. The key is to keep your routine enjoyable and beneficial. Now, let's apply these steps to a practical example. Imagine you've identified that you enjoy spending time in nature and find it relaxing. You might set a goal to spend 15 minutes outside each day. You schedule this time for right after lunch, as that's when you tend to feel a midday slump. During this time, you practice mindfulness by paying attention to the natural surroundings. After a week, you evaluate how this is working for you and decide to adjust the timing to early morning as you find it helps you start the day on a positive note. Remember, the goal is to create a self care routine that works for you and your unique needs. It might take some trial and error to find what works best for you, and that's completely normal. I encourage you to take a moment now to think about how you might apply these steps to create your own self care routine. What activities would you like to incorporate? How might you schedule them into your day? Once again, please feel free to pause the video here if you want to take some time to brainstorm or write your ideas down. In our next slide, we'll discuss some practical tips for incorporating self care into your daily routine, especially considering the unique challenges of ADHD. Remember, this is a process that's personal and flexible. It's about finding what works best for you. Now that we've learned about the components of an effective self care routine, let's discuss some practical tips for incorporating self care into your daily life. These tips are especially tailored for individuals with ADHD, taking into account the unique challenges you might face when trying to establish new habits. 1. Use visual aids. For many people with ADHD, visual cues can be incredibly helpful in maintaining new habits. Create a visual schedule or checklist to track your self care activities. This could be a colorful calendar where you mark off each day you complete with your self care routine, or a chart where you add stickers for each activity you do. Having a visual representation of your progress can help maintain motivation and accountability. You might even consider creating a self care menu with pictures or icons representing different activities you can choose from each day. 2. Incorporate reminders. With ADHD, it's common to get caught up in tasks and forget to take breaks or switch activities. For this, use alarms, phone notifications, or apps to remind you when it's time for self care. You might get a gentle alarm to remind you to take a break and do some deep breathing exercises, or use a habit tracking app that sends you notifications. Some people find it helpful to place sticky notes in strategic locations as physical reminders. The key is to find a reminder system that catches your attention without being disruptive. Third, start with short sessions. If you're new to self care or find it challenging to focus for long periods, start with shorter sessions. Even 5 minutes of mindful breathing or a quick stretch can be beneficial. As you become more comfortable with your self care routine, you can gradually increase the duration of your sessions. Remember, consistency is more important than length. It's better to do 5 minutes of self care regularly than plan for longer sessions that you struggle to complete. And fourth, mix activities. Incorporate a variety of self care activities to prevent boredom and keep you engaged. This is especially important for individuals with ADHD who may crave novelty and stimulation. Your self care routine doesn't have to look the same every day. You might have a menu of activities to choose from, such as a brief meditation one day, a short walk another day, and a few minutes of journaling on another. This variety can help maintain your interests and make self care feel less like a chore and more like an enjoyable part of your day. It's important to remember that these tips are suggestions, not rules. Feel free to adapt them to fit your specific needs and preferences. The goal is to make self care a sustainable and enjoyable part of your routine. Now, I'd like you to take a moment to think about how you might incorporate these tips into your self care routine. Which ones resonate with you the most? How could you adapt them to fit your lifestyle and preferences? Feel free to pause the video here if you want to jot down some of your ideas and reflect on this. In our next slide, we'll address some common challenges you might face when practicing self care, along with strategies to overcome them. Remember, the key is to find approaches that work best for you and your unique ADHD symptoms and lifestyle. As we've discussed throughout this session, self care can be an incredibly beneficial tool for managing ADHD symptoms. However, it is important to acknowledge that you might face some challenges when trying to incorporate self care into your life. Next, we'll discuss some common challenges and explore strategies to overcome them. The first one is time constraints. One of the most common barriers to self-care is feeling like you don't have enough time. With ADHD, you might already struggle with time management, making it seem impossible to add another task to your day. The solution for this is remember that even brief moments of self-care can be beneficial. You don't need to set aside large chunks of time. Instead, focus on quick activities that can help easily be integrated into your day. For example, practice deep breathing for 2 to 3 minutes while waiting for your coffee to brew. Do some light stretching during commercial breaks while watching TV. Use your commute to listen to a relaxing podcast or audiobook. The key is to find small pockets of time throughout your day where you can incorporate self-care activities. 2. Difficulty staying consistent. Consistency can be a significant challenge for individuals with ADHD. You might start a self-care routine with enthusiasm but struggle to maintain it over time. The solution for this, if maintaining a routine is challenging, try pairing self-care activities with existing habits. This technique, often called habit stacking, can make it easier to remember and stick to your self-care practices. For example, practice mindfulness for a few minutes right after brushing your teeth. Do a quick journaling session while having your morning coffee. Stretch for 5 minutes after getting out of the shower. By linking self-care to activities you already do consistently, you're more likely to maintain the habit. And lastly, feelings of guilt. Sometimes people feel guilty about taking time for self-care. You might feel like you're being selfish or that you should be using that time to be more productive. Solution: it's crucial to reframe your mindset about self-care. Remember that self-care is not selfish. It's essential for your well-being. In fact, by taking care of yourself, you're better equipped to handle your responsibilities and care for others. Try to view self-care as a necessary component for your health, just like eating well or getting enough sleep. It can be helpful to remind yourself of the benefits of self-care, especially in relation to managing your ADHD symptoms. You might even want to write down how you feel after engaging in self-care activities to reinforce the positive impact it has on your life. Now, I'd like you to reflect on your own experiences. Have you ever encountered any of these challenges in your attempts to practice self-care? Can you think of any other obstacles that might come up for you? How might you apply the solutions we've discussed to your specific situation? Feel free to pause the video here if you want to take some time to think about this or write your thoughts down. Remember, overcoming these challenges is part of the process. Each time you engage in self-care, even if it's just for a moment, you're building a valuable habit that can significantly improve your ability to manage ADHD symptoms and to enhance your overall well-being. In our next slide, we'll summarize what we've learned today and talk about next steps. As we come to the end of our session, let's take a moment to summarize the key points we've covered today. This recap will help reinforce what you've learned and give you a clear picture of how to move forward with incorporating self-care into your ADHD management strategy. First and foremost, we've learned that self-care is crucial for managing ADHD symptoms. It's not a cure-all or replacement for other treatments, but rather a complementary approach that can significantly enhance your overall ADHD management strategy. We've discussed how self-care works by helping you maintain and enhance your physical, mental, and emotional well-being. This, in turn, can help reduce stress, enhance focus and productivity, support emotional regulation, and promote overall well-being, all of which are particularly beneficial for individuals with ADHD. We then explored the components of an effective self-care routine, which 1 is identifying self-care activities that resonate with you, 2, setting realistic goals, 3, creating a schedule, 4, practicing mindfulness during self-care activities, and 5, regularly evaluating and adjusting your routine. We also discussed practical tips for incorporating self-care into your daily routine, such as using visual aids, incorporating reminders, starting with short sessions, and mixing up your activities to keep things interesting. Importantly, we acknowledge that there can be challenges in implementing a self care routine, such as time constraints, difficulty staying consistent, and feelings of guilt. We explored strategies to overcome these challenges, emphasizing the importance of starting small, linking self care to existing habits, and reframing our mindset about self care. Remember, the key to success with self care is consistency and personalization. It's important to be patient with yourself as you develop this new habit. Celebrate small successes along the way, like each time you remember to take a moment for yourself or try a new self care activity. As you leave this session and begin to incorporate self care into your life, I encourage you to approach it with an attitude of curiosity and self compassion. Some days will be easier than others, and that's okay. Every time you practice self care, even if it's just for a few moments, you're strengthening your ability to manage your ADHD symptoms and promote your overall well being. Lastly, always remember self care is not a luxury, it's a necessity. It's an essential component of managing your ADHD and maintaining your overall well being. Now, I'd like to take a moment for you to reflect on what you've learned today. What was your main takeaway from this session? How do you plan to start incorporating self care into your daily life? And if there's anything you're still unsure about, feel free to pause the video here if you want to write your thoughts down or spend some time reflecting on these questions. On our final slide, we'll wrap up and provide some additional resources. As we wrap up our session on self-care techniques for ADHD, I want to thank you for your engagement with this material. Even in this recorded format, your commitment to learning and growing is a significant step to your journey of managing ADHD and improving your overall well-being. We covered a lot of ground today, from understanding the fundamentals of self-care to exploring specific techniques and strategies for incorporating self-care into your daily life, especially in the context of managing ADHD symptoms. Remember, the key takeaway is that small, consistent steps can lead to significant changes over time. For those interested in our services or wanting to learn more about our approach, please don't hesitate to reach out. You can contact us at info@easydoesitcounseling.com. Additionally, if you found this session helpful, I encourage you to explore other workshops in our psycho education and skills training series. Each session is designed to provide practical, evidence-based strategies for managing various aspects of mental health and well-being. Thank you once again for your time. I hope you found this session on self-care techniques for ADHD helpful and that you leave here feeling empowered with the new tools to support your mental health. Take care and see you next time.